All right, we are live. Everyone, this is Dr. Michael Kaye from the Center of Functional Health, and I'm glad everyone is here tonight. First of all, I want to wish everybody a happy and healthy new year. And tonight we're going to do something a little bit different. It's not a State of the Union, this is going to be the state of a health address, actually. So again, first, everyone, I wish you a happy, healthy new year. I hope you get the new year off to a good start. Now, listen, I know that the world is crazy. However, it's always been crazy. So let's put our crazy world aside and talk about what truly and really is important, and that's your health. And here's what we're going to do tonight. First, we're going to talk about the numbers and the trends. Second, we're going to talk about what moves the needle forward and why lifestyle isn't soft. Third, we're going to talk about dogma, how to get rid of the overwhelm, and we're going to talk real metrics. All right, so let's get into it. Let me start with saying something that I say in the clinic a lot. You deserve clarity, you deserve numbers that you can trust, and you deserve a plan that fits real life. So first, where are you right now? That's what we talk about. So let's talk about some of the trends. So diabetes and pre-diabetes. And here's what I see day after day, that more people are dealing with blood sugar issues more than they realize. In fact, when you look at the stats, the United States diabetes is no longer rare. It's not just for older people. It is increasingly common and it's increasingly normalized. The CDC reports about 38.4 million US adults have diabetes. That's roughly 1 in 9. And about 97.6 million adults have prediabetes. Many people have no idea. Now, if that's you, if you're thinking, yeah, but I feel mostly fine, that's exactly why this matters. Prediabetes often has no obvious symptoms, and it quietly increases risk for heart disease, kidney disease, nerve issues, and a whole list of problems later on in life. Worldwide, it's even bigger. The International Diabetes Federation estimated 537 million adults living with diabetes in 2021 and projects 743 million by 2045 if the trend continues. American Diabetes Association, 38 million Americans have diabetes in 2023, and the cost $412.9 billion. That's billions. Take that in for a second. Now let's zoom out. Diabetes doesn't live in a vacuum. It's deeply connected to heart disease and stroke. I have a family history of it. So let's talk about that. Here's what I see clinically. People often don't feel that heart disease is coming. It's not like your body always gives you a perfect early warning. Heart disease remains the leading cause of death in the United States. And globally, well, the World Health Organization estimates cardiovascular disease causes about 17.9 million deaths per year. It's a big number. If that number feels abstract, just remember that number, that's families, that's misgraduation, that's people who seemed fine, but were not. And now we have to talk about stroke. It's the same thought process. Stroke is the leading cause of death and a major cause of long-term disability. And what I want you to hear is this. A stroke doesn't just change your health. It can change your independence. That's all this with my own father. It can change your identity. That's deep. Now I want to bring up another trend that has a lot of people surprised. And that's because it's not one that we're taught to expect. And that's colon cancer. Colorectal cancer is increasingly diagnosed in younger adults. That's part of the screening recommendations that has changed. That's why. The USPST, that's the United States Prevention Services and Task Force, recommends screening starting at the age of 45 now, especially for average risk adults. So if you're in your 40s or if you have a family history that moves you to the front of the line, if you have unexplained GI symptoms, don't minimize it. Get guidance, get checked, get screened, especially if you qualify. If not, push for it. Now I want to talk about autoimmune disease. I want to be careful here because autoimmune issues are complex, but I also want to be direct because people need to feel seen. Autoimmune illness is complex. It doesn't always fit perfectly into one clean statistic, but clinically, we're seeing more immune dysregulation, more chronic inflammation, more mystery symptoms that eventually get labeled autoimmune. Let me say this clearly. Autoimmune illness is not in your head. It's not a character flaw. It's not a lack of willpower. It's physiology, often multifactorial, and it can change. So that's the foundation. Now, the question becomes, what do we do with this? And this is where a lot of people either get overwhelmed or they get pulled into a certain camp. a tribe, a diet religion. Let me explain. I want to share what moves the clinical needle forward, and that's lifestyle. Lifestyle is not a vibe. Lifestyle is a biological, physiological intervention. Chronic disease risk is influenced by daily inputs. I want you to think about nutrition, movement, sleep, stress load, alcohol, smoking, environmental exposures. This isn't motivational, it's documented. A major global analysis in the Lancet estimated dietary risks were associated with millions of deaths worldwide. Now, if you're thinking, okay, so are you saying it is all lifestyle? Nope, I'm not saying that. What I'm saying is that genes matter, trauma matters, microbiome matters, medications matter, socioeconomics matter, and here's a big one, community. Community matters. But lifestyle is often the most modifiable lever we can actually pull, especially when we personalize it. And personalization brings me to my main theme. Your philosophy does not always align with your physiology. This is a line that I use in the clinic all the time. Your philosophy does not always align with your physiology. And here's what I mean. So I'm going to use the vegetarian example. I'm not picking on anybody. I'll see someone who's vegetarian, philosophically, ethically, they feel that they're doing the right thing. And they say, I'm doing the right thing, but physiologically, they're telling me something else. Low energy, brain fog, fatigue, GI issues, maybe hair loss, poor recovery, feeling cold all the time. If that's you, I'm here to tell you that you're not wrong. Vegetarians can be done well. You just have to do vegetarian well. But it might mean that the execution is not matching your needs. Or there's something else underneath the hood. Not enough protein, poor iron status, low B12, omega-3 imbalance, digestion issues, gut inflammation, and dysbiosis. Or sometimes simply it's just not enough calories. So it's not that vegetarianism is wrong. It's just you want to do it the right way. Now listen, the same thing happens on the other side. So I'm not picking on one dogma versus another. This even happens in the keto carnivore world. The philosophically feel this is the ultimate human diet. But physiologically, they're sharing constipation, insomnia, anxiety, reflux, cramping, exercise performance tanks. Or the lab shift in a way that they didn't expect. And no one can explain why. So again, does that automatically mean that keto or carnivore is bad? No. And I'm a huge fan. I've seen it do a lot of great stuff physiologically. It may mean it's wrong for you right now. Or it may mean you're missing some fundamentals, electrolytes, food quality, fiber strategy, total intake, sleep, stress. Here's what I tell patients. In my clinic, it's not a one-size-fits-all. We want to choose strategies based upon your clinical presentation, your history, your lifestyle, and yes, labs when appropriate. So it's something I really want you to think about. But when I say metrics, I don't mean just labs only. So let me make this really practical. Metrics also include how's your sleep? Where's your energy at 2 p.m. after lunch? Do you suffer with mood issues, bloating, bowel movements, cravings, skin issues, joint pain? Where's brain clarity? Where's brain fog? How about training recovery? Because sometimes the most important lab is your lived experience tracked consistently. And here's what I see all the time. People are trying really hard. Big salads and green smoothies, blending every green that they can find under the sun, but they're bloated, exhausted, and they're foggy. Or meat, a slab of butter on it, coffee with MCT, butter and coconut oil, trying to biohack their life, but anxious, constipated, and sleeping poorly. The intent is great, but you can't optimize physiology without understanding what's underneath the hood. Sometimes we need to press the gas, and sometimes we need to use the brakes. And in the end, the power of health is often sitting right there at the end of your fork. So now let's talk another important aspect of lifestyle, and that's movement. Yes, nutrition matters, but movement is one of the fastest ways to change your physiology. Let me explain. I'm asked all the time, what's the best exercise I should do? And the answer is simple. The best exercise, and I'm sure you read this before, the one you will do and come back to do it 3 to 5 times per week, something that you enjoy. If that sounds too basic, good. Basics work. Basics are underrated, but they work. When I look at movement, I think of movement in the following buckets: mobility, core, strength, balance, and cardiovascular. All of these are important. I love balance. Balanced movement or balanced practice should be put into your daily life. Now, here's a simple one. When I brush my teeth, it's about 2 minutes. Electric toothbrush is 2 minutes. So I'll do balance work for 2 minutes while brushing my teeth. Twice a day is 4 minutes a day. That is 28 minutes a week. That's 112 minutes in a month. Simple, easy, consistent. That's what I love about it. I also want to talk about exercise snacks. I heard this term from Rhonda Patrick. Definitely listen to her podcast. Great podcast. Exercise snacks are short bursts of movements that you incorporate throughout your day. For example, at the top of every hour during an 8-hour workday, do 10 reps of a movement. Squats from the chair, wall push-ups, marching in place, desk lunges, sit-to-stands. Doesn't matter what you do, just do something for 10 repetition. 8 hours a day, 80 reps in a day, 5 days a week is 400 reps. That's 1,600 reps in a month. It costs little time, it costs no money. If that's you, especially if you're sitting most of the day, this is one of the easiest levers you can pull. It's a great win. So what kind of exercise should you do? People ask all the time: bands, machines, dumbbells, barbells, kettlebells. I love them all. And it also depends. What's your baseline fitness, your age, your joints? What do they feel like? Any injuries? Make sure you have clean technique. The worst thing you can do is do too much too soon with poor form, and then you get injured. Just remember, following an influence because they look good, that's not a plan. You need to start where you are. You need to learn the basics, you need to learn the movements, and you have to build consistency. And once it comes to cardio, it doesn't mean you start running like a banshee and, just start with walking. Do something easy. It has to be consistent. Think 15 minutes a day is a great start. If you can walk after your largest meal, or after lunch, it's even better. Now, what about supplements? This is the part where people want the quick answer, the quick fix. But the honest answer is usually, well, it depends. I don't know what you need. Let me explain that. People often ask, what supplements should I take? And my answer is, I don't know. What the hell is wrong with you? We got to figure it out. What's going on inside? What are your symptoms? What are your goals? What medications are you on? Supplements can help, but in many ways, it's still the wild, wild west. If we take a supplement, there should be a reason, a plan, and metrics to see if it's working. Yes, let's look at those metrics. Quality does matter with the supplement as well. I've seen so many fake or questionable products online, and it's not good for you. If you like a specific supplement, I'll put a link at the end of the show notes here, and you can register my dispensary. These are for professional grade supplements. And remember that supplements and medications often have interactions. And don't guess, you need to know what you're taking. Now we have to talk about AI, because AI is already changing how people learn about health. And honestly, some people are really not using it well, and some people are scaring themselves to death. And yes, your doctor is probably using it as well, just to let you know. AI isn't going anywhere. I just want to be clear about that. And by the way, this is the real Dr. K talking to you, not the AI Dr. K talking to you, because if it was the AI Dr. K, there would probably be better lighting. Now, here's a real type of scenario of how AI or a patient input can go wrong. I had a patient call very upset over the weekend. They thought that they were in metabolic acidosis. Now, this is very serious. They had a slightly low carbon dioxide on their labs. I typed in low carbon dioxide into the AI model and got a scary explanation. You see, lab interpretation depends on context. One marker slightly out of range is not a diagnosis by itself. So, can AI help? Yes. It can help you learn the language around a diagnosis. It can help you create questions for your doctor, or if you're going to see a specialist. But can AI be your doctor? Not right now. It's getting close, but not right now. It's a tool, not a replacement for clinical judgment. Also, AI references are not always accurate. You want to verify claims and don't let a chatbot talk you into panic. And since we're talking labs, there are many online labs you can now order. I love this freedom. However, I'm getting weekly phone calls asking to interpret their report. It's a cool report, but they don't understand what it means. Some companies even have AI create supplement and a food list based upon those findings. However, the supplement recommendations does not take into account that the medications that you're taking. And you don't even get a chance to speak with the doctor. Now, recently, another company capitalized this and they came out with their lab panel and you can speak with the doctor. However, I question if there is weekly support thereafter. And yes, our clinic also has amazing lab panels that you get, and I help you interpret it, and we create a game plan. So now let's talk symptoms. This is one of the most important portion of this whole talk, because symptoms are information. If that's you, if you've been ignoring little things, I want you to listen closely. Symptoms are signals. Yes, they're signals. It's information. The question is, are you paying attention? Sometimes symptoms seem innocent. My joints hurt, just probably getting older. I'm winded when I go up the stairs. I'm just out of shape. I stand up and see specks. Well, that's normal, right? I'm bloated. Well, everyone's bloated. Listen, I grew up in Philadelphia. I thought everyone was bloated. My whole house was bloated. There were Rolaids everywhere. I thought they were just after dinner mints. So that's not normal, though. Your body has warning signals, just like your car. And it's interesting. We'll take our car to the mechanic for a noise, but ignore symptoms in our own body for years. Doesn't make sense. If something feels off, investigate early. Now, I also want to acknowledge something. A lot of people feel discouraged by the healthcare system. I get it. I hear it all the time. And let me speak to that for a second. Some of you are thinking, Doc, every time I go to my doctor, they just give me a medicine and they don't listen, a pill for every ill. That's what I hear. Now, some people have had that experience. The system is under great pressure. The cost of health insurance is increasing. Time is limited. Insurance itself is complicated. I get it. But I also work with some excellent doctors, primary care, and great specialists who listen and collaborate. That's the key term, collaborate. And sometimes you have to find the right fit. Conventional medicine is amazing for emergencies, trauma, and surgery. It saves lives. But building health, metabolic health, immune resiliency, energy, and digestion often requires more. It requires a plan and often a team. So where do we go from here? Well, this is the part I want you to hear as a human being, not just as a patient. We're going to keep it simple. We're going to keep it real. And that's what's most important. So where do you begin? It's that first step. Well, it's not with perfection. It's not with a 47-step morning routine from someone who has a chef and a house manager and 2 hours a day to train. That's not realist. You begin with something small, something that's repeatable. A 15-minute walk, exercise, snacks, going to bed a little bit earlier, more hydration, more balanced breakfast with protein, less ultra-processed food. Simple, easy. Lastly, I plan to do more of these types of talks, practical conversations that actually moves the health needle forward. Social media has some phenomenal educators, but there's often a gap between their lifestyle and real life. If someone's routine got easier after hiring a chef or a house manager, believe them, most likely it made your life easier, but that's not real. So let's keep it real here. The goal here is simple changes that are doable and repeatable. And here are some things happening in the clinic right now. Tomorrow night, we're going to start our 6-week vital reset, focusing on optimizing the gut, heart, and energy systems. I hope to have more interviews with other health professionals. That'll be a lot of fun. We're going to be working on a CGM challenge. That's a continuous glucose monitor. And in March or April, we hope to have some in-person presentations. Now, hope you enjoyed this. If you have any questions, drop them in the comments below. Reach out. Let's make 2026 a healthier year, one step at a time. Stay healthy, stay strong, and we'll see you soon.